So if we could just go back to abstinence for a second, we all know it's lousy public health policy, and in the US, it means that we're not talking about sex in a realistic way with young people, and in low-income countries, it means that HIV is spreading rapidly among married women because their older promiscuous husbands bring it to the marriage, and rape is increasingly used as a weapon of war. So why the US reliance on abstinence for HIV prevention, and is there hope in terms of new legislation in this Congress? Okay.
Well, I think that in the global context, abstinence only doesn't make sense in HIV/AIDS prevention. I actually printed out a copy of our own government's report on this front. It's called the United States Government Accountability Office, and it's an April 2006 report on global health, and talks about the funding of this government in its PEPFAR account, which is the HIV/AIDS account. And the GAO office does say that our current legislation requires that 33% of all the funding, the HIV/AIDS prevention funding that is undertaken by PEPFAR, be focused on abstinence only. This report says that that is a mistake, and that there are inherent challenges in an abstinence-only program, that it does not respond to cultural norms and realities on the ground. Those are my words, but that's really what it says. Because in countries, in most of the PEPFAR countries, which are mainly based in sub-Saharan Africa, young girls are the new face of HIV/AIDS. Most of the young girls often are married. Abstinence is simply not a choice. So how can you talk about abstinence only with a married adolescent or a married young girl? That is the first issue you face. The second issue you face really is that many girls don't have the choice of not being engaged in sexual activity, because sometimes they have sugar daddy situations in which they're economically exploited, they're sexually exploited. So abstinence is just not an option. And I'm talking about just the reality of women's lives. I'm not even talking about the philosophical framework which you referred to. So I know that people will have questions, so I'm just going to keep this answer just about that short and say that I think all of us pretty much agree that abstinence only is not an effective program. What UNFPA engages in is the ABC approach, which is abstinence, be faithful, and condoms, with an emphasis on condom usage, because condom usage is double protection, because you can prevent a pregnancy and you can be prevented against STIs. It is the only form of birth control that can generally do that. And it's therefore a very important one to promote.
Well, I must say that this was my favourite question of the ones that were circulated to me. And I think because it goes beyond abstinence. And it's got good news in it. And the good news is it's always so difficult to get more money. I mean, there isn't enough money to go round, and we're all worried about the deficit. But this is a real opportunity to say what works and doesn't work. You know, what's the goal? Is the goal to prevent the transmission of HIV/AIDS? And if so, what's the best use of the money in order to achieve that goal? And I'd like to read something else. I was having an interesting time while I was getting ready for this panel. This may well play more to Carol's area. But I found a CECUS, is that how you pronounce it? Press release on April the 13th that was about a domestic program. And it said that a federally supported evaluation had been conducted by Mathematica, which is a highly reputable research organisation, on behalf of DHHS, of abstinence only until marriage programs domestically here in the US, funded under 1996 federal welfare reform law, and that this had proven ineffective in changing teens' sexual behaviour. Well, that's not surprising. I think that wouldn't surprise any of us. But the interesting thing was that somebody called Robert Rector, who was an abstinence-only advocate, outlined strategies that the movement could now use to combat this unfortunate research finding. And he said, apparently, the other spin I think is very important is not programme effectiveness, but rather the values that are being taught. Whether or not these programs work is a bogus issue. And so I think that applies to many things. I mean, it certainly applies to having these earmarks but it also applies to many other things like, oh gosh, now where was my, sorry, I've lost my piece of paper, but things like drugs, if we have drugs that are effective for, you know, for HIV/AIDS, or that we have to use FDA-approved ones, even if there are ones that would be much cheaper or more readily accessible that have been approved by the World Health Organization. There are often complicated procurement policies that go along with, in relation to condoms, for example, that go along with having US government funding. So there are all sorts of barriers that are put in the way of our using the money that we do have as effectively as possible for the stated goal. So, over to you, Carol.
I think, you know, reading Sikas's release about the Mathematica study really gets us there. There's one other thing, though, to say about abstinence only that we find really troubling in our work. We do an enormous amount of work with gay, lesbian, bisexual, transgendered, and questioning young youth. None of these programs give them any place to go at all. Because the programs are required to teach that heterosexual marriage is the only acceptable standard of human sexuality. And so it's, you know, it has had far-reaching consequences, and I agree that it's a values agenda more than it's anything else. What we know about responsible sex ed is kids do delay first sexual activity. That's good. But when they do engage in sexual activity, they are much more likely to be protected under the abstinence only until marriage framework. And please remember, as I'm sure you get, it's not abstinence only through high school or abstinence only through college. It is abstinence only until marriage. And the age of first marriage now in the U.S. is 26 for women. So 90% of the kids graduating from high school have had sex. So, you know, it just so comes apart from what, you know, our experience has been. I just think there's, you know, a lot of stuff here. So governors are starting to turn the money back. Now we're in a pro-family planning Congress. You're going to have the political issue of politicians liking to say that they're for abstinence and feeling that when we move from abstinence to contraception, we're moving too quickly. So, you know, I think what you'll see the Congress do is flat fund or cut the abstinence-only money. We've spent $1 billion on this program, though, in the last 6 years alone. $1 billion. And that federally funded study, which was created in the welfare reform legislation, just said it's all useless money.
And Claire, isn't there some funding now for abstinence-only education for adults?
Yes.
And not just teenagers? Yeah, no. Do you know offhand how much or what?
I don't know which percentage of the whole program.
I just remember reading that article and being...
Yeah, because it's until marriage.